Assalamu alaikum students. This is the continuation of lecture on anemia. So inherited hemolytic anemia includes hemoglobin abnormalities. For example, very important thalassemia and sickle cell anemia. So we will discuss them one by one. So thalassemia is the autosomal recessive inherited disorder. So be remember it is autosomal recessive. So characterized by abnormal hemoglobin due to mutation in the DNA of hemoglobin producing cells. Types alpha thalassemia and beta thalassemia. You can see the target cells in the morphological picture of thalassemia. These are specific to thalassemia. Alpha thalassemia occurs in fetal life. Alpha genes are less, absent or abnormal due to genetic defect at chromosome 16. Beta genes are in excess in adult. Gamma genes are excess in children. Defective hemoglobin, which results in hemolysis of the RBCs, resulting in anemia. Beta thalassemia, beta genes are less in number, absent or abnormal due to defect at chromosome number 11, excess of alpha genes precipitate during erythropoiesis. So the symptoms include thalassemia major. In thalassemia major, there is stillbirth. In children's, bone deformities in the face, yellow skin, that is jaundice, fatigue, growth failure, shortness of breath. While the second type of thalassemia, that is thalassemia minor, there are no symptoms. So the bone deformities in the face are very specific in thalassemia, which are called thalassemic fishes. And you can see this face of a child. This is very specific appearance of thalassemia. The clinical presentation: shortage of red blood cells, anemia, pale skin, weakness, fatigue, enlarged liver and spleen, that is hepatosplenomegaly. So hepatosplenomegaly is there. Because spleen is enlarged, because spleen works more, because spleen is the graveyard of RBCs. So here there is excessive destruction of RBCs, and the RBCs become deposit or destroyed in the spleen, as it is the graveyard. So spleen works more, and its size becomes large. So there is splenomegaly. Normal production of alpha genes is absent, which results in excessive production of gamma globin genes in the fetus and newborn, or beta globin genes in children and adults. The beta globin genes are capable of forming soluble tetramers. This form of hemoglobin is still unstable and precipitates within the cell, forming insoluble inclusions called Haynes bodies. These Haynes bodies damage the red blood cells. This further results in damage to erythrocyte precursors and ineffective erythropoiesis in the bone marrow. So hypochromia and microcytosis of circulating red blood cells. The picture is like the iron deficiency anemia. So the two types, thalassemia major and the thalassemia minor. In thalassemia major, which is also called Colles anemia, severe form of beta thalassemia, presence of two abnormal genes that cause either a severe decrease or complete lack of beta globin production. while in thalassemia minor, presence of one normal gene and one with a mutation, and the cause is mild to moderate anemia. So the pattern of inheritance of thalassemia, the two parents are the carriers, and one is offspring is normal, while two have a thalassemia trait, they are carriers, and one has severe thalassemia. Because it is autosomal recessive disorder, that's why one offspring is affected in case of when both the parents are the carriers of thalassemic trait. Dark urine, abnormal facial bone and poor growth, a poor appetite. Adolescents with the severe form of beta thalassemia may experience delayed puberty. So these are the problems with the thalassemia. Now the sickle cell anemia, very important one. Inherited blood disorders, sickle shaped RBCs, abnormal S hemoglobin, alpha chains are normal, beta chains are abnormal, S hemoglobin polymerize and precipitates, bones in X-rays have a sawtooth appearance. That is very important finding. Sickle cell disease inheritance, it is a homozygous recessive disorder. It occurs in individuals who have inherited two abnormal genes, one from each parent, that code for the synthesis of beta chain of the hemoglobin molecule. Heterozygotes have one normal and one sickle cell gene. The blood cells of these individuals contain both hemoglobin S and hemoglobin A. These individuals have a sickle cell trait, and they usually do not show the clinical symptoms and can have a normal lifespan. So you can see the pattern of inheritance of sickle cell disease. When the two parents, when the mother and the father are heterozygous or having a sickle cell trait, one offspring is normal, two offsprings have a thalassemic trait, and one offspring is affected. Sickle cell anemia, when this hemoglobin is exposed to low oxygen concentration, it precipitates into long crystals inside RBCs. The precipitated hemoglobin damages cell membrane and give red blood cells a sickle appearance. Highly fragile, leading to serious anemia. Such patients experience a vicious circle of events called a sickle cell disease crisis, in which low oxygen tension in tissues causes sickling, rupture, red blood cells, further reduces oxygen tension, and still more sickling and red cell destruction. So there is a vicious cycle of rupturing of red blood cells due to low oxygen tension. Sickle cell acute chest syndrome. Acute chest pain with fever is a common complication of sickle cell disease. Pulmonary opacities are frequent seen on chest x-rays. Unclear if the etiology is ischemic or infectious. Acute chest syndrome is treated with empirical antibiotics and sportive pain therapy. This is the morphological picture of sickling of RBCs. You can see sickle shaped RBCs. This is again a crescent shaped or sickle shaped RBC. This is again sickle cell anemia. Now there is aplastic anemia due to disorders of bone marrow. Red bone marrow is reduced and replaced by fatty tissue. The reasons behind aplastic anemia include X-rays exposure, bacterial toxins, tuberculosis, and viral infections. So when the bone marrow is involved, there is aplastic anemia. Because as you know, the pluripotent hemopoietic stem cells are present in the bone marrow, from where all the blood cell types are formed. So when the pluripotent hemopoietic stem cells in the bone marrow are affected, then all the cancer cell lines will be reduced. Inherited hemolytic anemia includes the third type, that is metabolic disorders of RBCs, glucose 6-phosphate dehydrogenase deficiency and pyruvate kinase deficiency. This glucose 6-phosphate dehydrogenase deficiency is very important regarding because this glucose 6-phosphate dehydrogenase enzyme is important in glycolysis. And also in the activity of antioxidants. So when this enzyme is deficient, the antioxidant activity is reduced. As a result, reactive oxygen species are produced in excess, and these reactive oxygen species will result in damaging or destruction of RBCs, resulting in anemia. While this pyruvate kinase is important in the production of pyruvate, so when there is a production of pyruvate, there is production of ATP. So when the pyruvate kinase is deficient, because phosphoenol pyruvate is converted into pyruvate in the presence of pyruvate kinase, and there is production of ATP. But when its deficiency is there, when pyruvate kinase is deficient, then pyruvate is not formed or formed in a reduced amount, and there is a reduction in ATP production. So when there is a reduced ATP, there is a reduction in energy source, there occurs hemolysis of RBCs, and there is anemia. Acquired hemolytic anemia, immune cause includes examples. Number one is auto-antibodies, drug-induced antibodies, and alloantibodies. Auto-antibodies include when there is activation of autoimmune system or there is autoimmune disorders are there. So there is increased hemolysis of RBCs, and there is anemia. In drug-induced antibodies, there is the example of ibuprofen, or there is the example of cephalosporins. So these drugs results in the production of antibodies, and which results in the destruction of RBCs and resulting in anemia. While in alloantibodies, there is the example of blood transfusion. When there is a mismatched blood transfusion, there are the antibodies which result in hemolysis of RBCs as a result of antigen-antibody reaction. Acquired hemolytic anemia, second type is non-immune. There is microangiopathic hemolytic anemia, which is due to the injury to red blood cells, which results in the formation of clots in the blood vessels. And the second one is parasites including that is malaria. This malaria also results in hemolysis of RBCs, resulting in anemia, and in burns there is also injury to the blood vessels and RBCs, which results in anemia. So symptoms of anemia includes that results due to reduced oxygen carrying capacity of blood, resulting in tissue hypoxia. The hypoxia causes symptoms like easy fatigue due to muscle hypoxia and faintness due to cerebral hypoxia, especially on exertion. Faintness is the dizziness or color of skin, conjunctiva, pharyngeal mucosa, and palm and nail buds become pale, headache, lack of concentration, restless, irritability, muscle becomes weak, and the patient gets fatigued quite often and quite easily. Nausea, vomiting, abdominal discomfort, and constipation are also there. So effects of anemia on function of the circulatory system. The viscosity of blood depends largely on the blood concentration of red blood cells. In severe anemia, the blood viscosity may fall to as low as 1.5 times that of water, rather than the normal value of about 3. This decreases the resistance to blood flow in the peripheral blood vessels. So far greater than normal quantity of blood flow through the tissues and return to the heart, thereby greatly increasing cardiac output. So when there is decreased resistance, there is increased venous return. So when increased venous return or increased return of blood to the heart, there is increased cardiac output. More blood comes out from the heart. Moreover, hypoxia resulting from diminished transport of oxygen by the blood vessels causes the peripheral tissue blood vessels to dilate. So on one hand there is dilation, and on the other hand there is increased cardiac output, allowing a further increase in the return of blood to the heart and increasing the cardiac output to a still higher levels, sometimes 3 to 4 times normal. So firstly, there is decreased resistance due to decreased viscosity, which results in increased venous return and increased cardiac output. Secondly, due to hypoxia, there is vasodilation, which results in increased venous return and increased cardiac output. So as a result of both of these factors, there is increased cardiac output to 3 to 4 times normal. Thus, one of the major effects of anemia is greatly increased cardiac output as a result, as well as increased pumping workload on the heart. So when the heart works more, it weakens the heart. So these are the negative effects of anemia on the circulatory system. So regarding the treatment of anemias, there is iron deficiency anemia. Firstly, the most common type. The treatment option is intake of iron in ferrous sulfate form. So in pernicious anemia, which is due to the deficiency of vitamin B12, injections or tablets of vitamin B12 are used. And in megaloblastic anemia, intake of folic acid is recommended. While in hemolytic anemia, bone marrow transplant or there is a blood transfusion is there. While in thalassemia, blood transfusion, iron chelating therapy, that is defuroxamine injections, their folic acid, and splenectomy is very important regarding thalassemia, because spleen is the graveyard of the RBCs, and in thalassemia the RBCs have shortened their life. The lifespan is shortened. So there is more hemolysis in thalassemia. So to prolong the RBC's lifespan, spleen is removed so that the RBCs can live more than 120 days, which is their normal lifespan. Because the patient is on blood transfusion, continuous blood transfusion, that's why these RBCs are very vital or very important for that patient. So to prolong the lifespan of RBCs, splenectomy is done. And the other option is bone marrow transplant. While in aplastic anemia, there is blood transfusion, and the definite treatment is bone marrow transplant. So these are the treatment options of different types of anemias. If you have any query regarding anemia, you can contact me.